You know, it's summer when we have to tell you about a new report finding Lyme disease on the rise. It is a bacterial infection. It actually spreads through ticks. That part you might not know. But Dr. Siegel, what else do you want us to know?
Jamie, I was just going to say it's bacterial. You see, you started it again. It's a black-legged tick, and you got to watch it in areas that are infested with deer. And like here in New York, the Northeast, the Pacific Northwest, also the Midwest, northern Midwest areas. And it's very problematic because you may not know you get it. Most of the time, if a tick is on you for more than 36 hours, that's when you're at risk. And not all ticks in the area carry it, but many do. Then you may get a rash. 60 to 80% of the time, you're going to get a bullseye rash or a red rash right around the area where the tick bit you. That'll help you because then you'll know to get treated. But other than that, you may just get fever, you may get malaise and fatigue, and you may not know where that's coming from. If you're in this region, you better get checked out because antibiotics, Jamie, especially doxycycline if you're an adult, which I prescribe all the time, can help you if you have early Lyme disease, and it can cure you. If you got a tick on you, don't pull it out. Try to get it out with a tweezer and get the head out and get the pincers out. That's really important because otherwise you still could get Lyme disease. You got to get serology blood testing, but that doesn't work right away. Now, I would like people out there to use insect repellent with DEET to keep their lawns short. And in my case, you got to put the deer fencing up. If you got deer everywhere, you got to put the deer fencing up.
All right, Dr. Samadi, what else do you want us to know in terms of knowing that it's Lyme disease getting tested?
Well, besides the symptoms, where you're going to feel very fatigued, you may have headache, you may have paralyzed face, you may have even sometimes depression. I think this diagnosis is a black box. I think it's very difficult and the patients get very frustrated. Number one, only about 15 to 30,000 people in the country are affected by this. The epicenter of this is Massachusetts, but there's a lot of overlap with other diagnosis. For example, some people may think this is fibromyalgia, some people may think it's a chronic fatigue syndrome. So the patients may go from doctor to doctor and they could be on some antibiotics without any result. I think the frustrating part of this is that how do you diagnose it? And you may not always have the antibodies, number one. You may not always have this bullseye rash that Mark just described. And the other thing is that the standard of care is to get about a month of antibiotics. For arthritic Lyme, you probably get about 3 months. But sometimes these patients can go on for months and years on antibiotics. So I think, it's still a diagnosis of exclusion. And I think, that's why you have patients that are frustrated. You just have to go through the testing and talk to your doctor.
And don't ignore it. Doctors,
Exactly.
Thank you.